Thank you all for coming today. My name is Amy Porter, and I'm the Commissioner of the Department of Aging and Disability Services here in Connecticut. I want to thank Nichelle Mullins and the team here at Charter Oak Health Center for hosting us here today. This is great. A community COVID testing event is really the perfect setting to talk about some of our new community support initiatives. I'm going to provide a little bit of an overview of some of our community support initiatives and some examples, and then we're going to hear from all of our distinguished guests here. So we all know by now that we all need to do our part to keep our communities safe. We've heard a lot in recent months about the importance of testing, especially if you're feeling sick, if you're symptomatic, get tested. And we know that if we test positive, or if we're identified as a contact of somebody who tests positive, that we need to stay home. We need to stay home from work. We need to stay home from the grocery store. We need to stay home from community events that we might want to otherwise go to. We've heard terms like self-isolate and self-quarantine. Basically, these terms describe the recommendation that our public health officials are giving us if we test positive or if we're a contact of someone who tests positive. The recommendation to stay home, away from others, so that we don't spread the virus. This isn't an easy request for any of us, and we're aware of that, but it's so critical for keeping the virus contained here in Connecticut. For some, there are significant barriers to being able to follow that recommendation to stay home. And this is where our community supports initiatives come in. The cornerstone of these new initiatives is our Community Resource Coordinators, or our CRCs. These coordinators bring an extra layer of support and connection, tapping into the incredible resources that our communities are already offering and leveraging existing local, state, and federal resources. We all know that our communities bring so much to the table, but sometimes navigating to those resources, figuring out the right place to go, the right place to start is the challenge. So our coordinators are there to make that easy for folks. They're here to help people who have to stay home, identify what their specific barriers are, and work with the individuals and their community to resolve those needs. So, how does this work? If you test positive, or if you're identified as a contact of somebody who tests positive, somebody called a contact tracer is going to reach out to you. They're going to explain that you need to stay home for a certain period of time, usually about 2 weeks. Then they're going to ask you whether you need any assistance in order to follow that recommendation. For many, the answer is no. For many, the answer is, I have no idea. But if you are somebody who needs assistance, as you have to think about staying home for a couple weeks, we're going to connect you to a community resource coordinator to help you think about that. We've added them to the system as a way to help you problem solve, to think about how to connect to the resources that are already there. So what are some examples of this? Maybe you live in a house and there's 4 other folks who live with you in your house or your apartment, and you don't know how you can stay there without spreading the virus at home. Our CRCs can help you come up with a solution that works for you, and obviously that's going to be different for every person. Sometimes it might mean learning about additional precautions you can take in your current living situation and getting you the supplies that you need to do so. Sometimes it might be offering you a safe place to stay. We have some new dedicated resources here if needed. We've dedicated $220,000 from our Coronavirus Relief Fund to support short-term housing for folks that need it, and we're continuing to look at other options as our communities bring those forward. Another example, maybe your doctor or your clinic called to tell you that you tested positive on the day that you typically go grocery shopping, or to the food pantry, or to the pharmacy. You know that you can't really stop on the way home without putting others at risk, so you might need some assistance to problem solve. CRCs can help connect you to a local food pantry or delivery service. They can even help to navigate you to get your prescriptions filled. If you're concerned about a loss of income, if you can't go to work, our CRCs can look at your individual situation and see what options exist for you. They could get you connected. Maybe you're able to take sick time from your job. Maybe you're covered by an unemployment insurance. If not, the CRCs can work with you to try to fill the gap. This is possible because of the generous support of 4CT, who committed over $100,000 for this purpose specifically. Our community resource coordinators are employed by local social service agencies. We wanted to be sure that we were able to use organizations that already had connections and relationships in their communities. And we have our incredible partners. Some of those folks are here with us today, so thank you for coming. This effort is the result of so many, and if I started the list of thank yous, we wouldn't make it out of here before dark, because so many people have been involved. So let me just say that I am fortunate that the governor gave me the opportunity to work with an incredible and diverse array of partners on these initiatives. These partners bring such commitment and creativity and energy to the table, always with ideas, always with new ways to look at things, always with, of course we'll do that, let's figure out how. And they're really there to help ensure that anyone who's asked to stay home can safely and effectively do so, ensuring that we all stay healthy. So a lot of great initiatives, a lot of great things going on in our communities, a great place to be able to sort of launch this initiative. And we've got some great speakers today. First, I'd like to turn the mic over and introduce the Mayor of Hartford, Luke Broden.
Thank you so much, Commissioner. Good morning, everybody. And Governor, Lieutenant Governor, thank you so much for this initiative and for announcing it right here in Hartford at Charter Oak Health Center. I also want to say a huge thank you to Nichelle Mullins and the entire team at Charter Oak Health Center for the work that they do. We are here at a site that is a community testing site. Every single day, 8 to 5. You can come here and get tested, and that's in addition to the mobile testing that Charter Oak Health Center and our other federally qualified health centers are doing throughout the city because of the partnership with the state of Connecticut and because of our collective efforts to reduce the barriers to testing. I also want to acknowledge T.J. Clark, who is here both as Majority Leader of the City Council and also as a part of the Charter Oak team, who's been doing a lot to help get that testing out in the community. But, Governor, this initiative is such an important one, and I want to thank you for it because, as you know, we've been working hand in hand to encourage everybody to get tested. And in vulnerable communities where we've seen a disproportionate impact, we're particularly focused on making sure that there are low barriers to testing. So here in Hartford, to get tested, you don't need symptoms. You don't need insurance, you don't need a prescription, you don't need to pay, and if you don't have a car, we'll give you a ride. But the next piece of that is that if you test positive, we need you to protect those around you. We need you to protect your loved ones, we need you to protect your co-workers, we need you to protect your classmates, we need you to protect your community. And the way to do that is to isolate for a period of time while you get healthy. But this commitment today is an important one because what it says is when you take that measure to protect those around you and protect your community, you will be supported through it. Whether that's with food, whether that's with housing, whether that's with any number of the other supports that the Commissioner just talked about, that is a critical commitment to you that if you do your part to keep your community safe, you'll have the state of Connecticut, the city, and critical partners like here in Hartford, CRT, doing the work of supporting you through that time. So I can't say enough how important this is as a piece of the puzzle to keeping our community safe. Again, I want to stress to everybody, please, if you think you have any reason to get tested, and hopefully this takes one more reason for anxiety or fear away. Because I know that some people are worried that if they get tested and they test positive, that they will then have to isolate. I hope what you take from this important announcement is that if that's the case, and if you've got to isolate for a while to keep others safe, you will be supported through it. So, Governor, thank you so much for it. Commissioner, Lieutenant Governor, and of course to the entire Charter Oak team for the work you do every day. Great to be with you.
Thank you. That was a great PSA for testing here, so very good. So next, I would like to invite Nichelle Mullins to come speak with us. She's the CEO of Charter Oak Health Center and our host today. So, Nichelle.
Thank you very much. Good afternoon, everyone. It is a pleasure to host all of you today, and I cannot echo Commissioner Porter and Mayor Broden's remarks enough. We are serious about testing, so much so that we have turned our patient parking garage into an outdoor testing site, and we are testing throughout the city 3 to 4 times a week. I know many people have seen the Charter Oak mobile van around the city in partnership with Trinity Health of New England, along with the state, the city, and the Black and Puerto Rican Caucus. We have tested over 10,000 individuals since May at over 60 sites within Hartford and surrounding communities. We see firsthand how COVID-19 has and continues to impact families and communities. In order to overcome this virus, we must continue to wear face masks. We must continue to practice social distancing guidelines. We must continue to wash our hands and adhere to all of our governor's executive orders. I have to also underscore the importance of staying home when you are sick, and also adhering to all of your advice from your medical providers to quarantine. I understand quarantining may be difficult. It may feel impossible at times for a variety of reasons, and that's why I'm really excited about the programs that are being announced today. Charter Oak Health Center, as well as the other health centers around the state, have community health workers who can put you in contact with one of the community resource coordinator programs around the state, so that you will have access to whatever resources that you need to get you through the quarantine process or time. It's critical that individuals have access to food, short-term housing, and other resources so that they can safely stay home from work or school to protect their family, their friends, and their neighbors. These programs will assist in that effort. As many of you know, Connecticut ranks amongst the top states in the country in terms of our response to COVID-19. Navigating this pandemic has not been easy for anyone. None of us had any playbooks. Charter Oak Health Center salutes the efforts of the leadership of the state under the guidance of Governor Lamont. We are very, very fortunate to be in a state with such strong leadership, both on the state level and in Hartford under Mayor Bronin. And without any further remarks, I would like to introduce Lieutenant Governor Bicewicz. Thank you.
Nichelle, thank you so much. This summer, the governor and I visited an immigrant support organization in Stamford. And while we were there talking to some residents of Stamford, they told us that one young lady actually said that her dad worked through, he kept going to his job while he had COVID because he was so afraid he'd lose his job. He couldn't pay for his rent, for food. And it was very clear to us that it was important that we put together a support network for everyone in our state in case they tested positive and needed assistance while they were quarantining or isolating. And so we are launching today something that has been in the works for months since we realized we needed to take these steps to make sure that our vulnerable communities have the resources they need, whether it's food, whether it's housing support, whether it's access to food pantries or to additional resources so that their families can be safe. And this is also very important that we launch this and get the word out that these services and supports are available to people across the whole state, not just in Hartford, but in every area of the state. And it's important that people know that, because now that we've had kids back in school for a couple of weeks, that our colleges and universities have had students back for almost a month, we're seeing some very concerning spikes in our numbers. So we want people to be aware that if you test positive, if you're feeling sick, please get a test. if you need help, if you need a place to stay so that you don't infect your family or your coworkers, that help is available. All you have to do is call 211 and you will be connected with the appropriate resources and help for you to get healthy, but also to ensure that everyone around you stays healthy as well. So I want to thank all of our community partners and all of the people, Commissioner Porter and Gifford, and all of the great people that we have on our team who have worked together to put together these resources. And now it's my great pleasure to introduce our excellent leader, Governor Lamont.
All right, thank you, Susan. And Amy, thank you for helping to get this coordinated, making it easier for people to get tested and what to do if they test positive. Michelle and Mayor Bronin, this is a partnership and teamwork. And Mayor, I like that bearded Abraham Lincoln look. I think stove by Pat, you'd be sharp. You know, we instituted a business one-stop to make it easier for people to start a business some months ago, being able to do that online. And I think of this a little bit like people one-stop, and doing everything we can to make it easier for you not just to get tested, but to know what to do if you test positive. And like Luke said, relieve some of the anxiety if you do test positive. And we're not out of the woods yet. As Susan was saying, colleges and business and people getting around, we are spiking up a little bit. And for the second day in a row, our infection rate is 1.8%. And we have more people hospitalized today, over 100, related to COVID than we've had any time since late June. And I don't want to overstate this. We're still one of the best in the country. And we're one of the best in the country when it comes to getting tested, and one of the best in the country when it comes to knowing what we got to do, and one of the best in the country when it comes to a low infection rate. But that's only because you're taking the necessary precautions, and we're doing everything we can to make it easier for you to take those precautions. So, you know, come here to Charter Oak, get that test. In the schools, we're going to have the 5-minute Abbott test, where if there's any symptom at all, we're going to be able to test you. You get a response in real time. And with that, if there is an infection, our community counselors are there to give you all the support that you need. We're there thanks to our great friends from 4CT. If you're worried, you're an hourly worker, you're at a restaurant, oh my God, I can't afford to get tested. If I get tested and I have to quarantine, I can't get paid, I can't take care of my family, we're going to step up, and 4CT is going to have their 4CT card that gives you some of the support that you know you may need. We got the medical packet that you'll get. It includes a thermometer, it gives you the mask, some of the other support that you may need. You know, Amy, we mentioned housing. And what we need in terms of if you don't have a place to stay, you can't quarantine in your home, you're in a multi-generational home situation, it's tough to stay separated, tough to keep your family safe and your community safe, we'll find a place for you to stay at a you know, nearby hotel, for example. Again, our counselor will be able to tell you, if that's where you are, how we can get food delivered to you so you don't have to go out into the broader community. And these are all ways that we're trying to say, do the right thing. We're doing everything we can to make it easier for you to do the right thing. And finally, if you have those symptoms and you've got to stay at home, we don't want you going to work. We've said what to do if you're in multi-generational housing. We are going to be rolling out our rent relief program as well. And that's one more way that people can stay in their apartment and stay safe. And what that means is right now we've had a non-eviction policy that went through the end of September. We are going to extend that through the end of this year. But we're not just doing that. We're also working with landlords and tenants. And we're going to be providing money up front, thousands of dollars, to those tenants who work out a relationship with their landlords, small landlords, so that they start a payment plan over the course of the next few months so they can stay in their apartment and a landlord can make the property tax payments and the electric payments and the things they've got to do to make sure that the housing stays solvent. We'll be rolling that out as a relationship, a partnership we have with both landlords and tenants. It's not easy as just sending out money, but it is a way that we can make this safe. And that's what we're trying to do every day, is to keep Connecticut safe. And there's really turbulent times. And November is going to be a really big month. You've heard me say, April back then, we were ramping up. The infection rate was tough. We saw our hospitals were close to being overwhelmed. And we made it through April. We made it through April without our hospitals being overwhelmed. November is going to be a close month. And that's why I'm really urging you, as Luke said, to make sure you keep the discipline. Make sure you get tested, any symptoms at all. Make sure you stay home, any symptoms at all. And we're trying to do everything we can to make it easier for you to follow these protocols, because that's how we're going to get all through this together. Thanks, everybody. Any questions for Susan?
Where'd you get the mask? That's very, very nice.
Oh, so thank you. So my friend Evelyn Daly, who's a probate judge in Farmington, gave it to me about a month ago. And I've been wearing it now as I've been in mourning for Justice Ginsburg's passing.
Governor, on the concern about November, can you talk about why November specifically that is a big concern to you?
November specifically, obviously schools and colleges came back, but right now we haven't seen any real flare-ups around that. I mean, schools were back in Arizona for over a month. Their infection rate's going down. Schools have not opened in New York City yet to speak of, and their infection rate is going up. They were over 3% yesterday. But there still is a lot more, less quarantining going on today than there was 6 months ago. And combine that with the flu season. Flu has very similar symptoms to COVID. That's why this 5-minute test is very effective. But that's why you want to get everybody to get the flu vaccine, so there's less likely to have those type of symptoms that could rush the emergency room. And finally, November, we're going to have a better idea by the end of November where we stand in terms of easier testing, 5-minute testing, where we are in the therapies, and perhaps a better idea of what vaccinations look like by the end of the year. It's a key few months.
And if I could just add to what the governor said, so flu season is October through May, and we have been encouraging people to get flu shots because a year ago, more than 3,000 people went to the hospital with flu-like symptoms, and we had 79 people die, including one child. So we just cannot have 3,000 people going to the hospital while we're also fighting COVID, and that's why we're urging everyone to get flu shots. I just got mine. Did you get yours yet?
Very soon.
Very soon. Okay.
And Governor, obviously we're coming up on the planned third phase of reopening, but you mentioned those spiking numbers. Is there a point at which you would reconsider that next step of reopening?
Yeah, October 8th is a date we're thinking about. If I saw it ramp up like I saw in Arizona and Florida, the speed at which that would be happening, that would give me real concern. Somewhere 3-5% is a change mark, depending on how fast things happen. But right now, we're not there. We're still less than 2%, 1.2% over the last 7 days, still very low, but we're watching this sharply. Well, you also look regionally. Obviously, Danbury was hit pretty hard. Norwich is getting hit pretty hard. Hartford has some infections right now. So you look on a regional basis, especially when it comes to schools and sports, because that tends to be more regional. Those are the ones. Well, obviously hospitals, Susan just reminded me, but let's face it, we have 100 there. We used to have 2,000 COVID infections in the hospital. So we've got an awful lot of capacity there. You know, the quarantine rules look more in terms of community spread, 10 per 100,000, and we've got a couple of towns that have exceeded that. So we're watching that carefully.
Governor, the Ledge Light Health District, Steve Mansfield, the director, is recommending that school systems in that part of the state, in London County, stay with the current plan that they have, which is a hybrid plan, some in school, some at home, rather than going back to school full time. Would your recommendation be to follow that throughout the state?
I don't think so. Look, as I said before, New York is spiking up. Their schools aren't open at all right now. The thing about the hybrid plan is, yes, you have more spacing in the classroom, but the kids now have 2 or 3 different cohorts. One is their 3rd grade class when they're in school, and the other is, for example, daycare, childcare, YMCA, whatever they're doing during those off days. So you have twice as many opportunities and twice as many people to track and trace if there's an infection. So I'm not sure that's the answer, but I'm sure being careful is the answer.
Just had a quick question. When it comes to the services that are being offered for those who are quarantined, I know that we said food, we said housing. Is there childcare? Is there any other services that they can actually look for?
You want to speak to that, Amy, on childcare?
I think so. Every person's going to have unique needs, right? So the idea is the community resource coordinator will do an interview with them, try to find out what the needs are. And all of our communities have different resources, so they'll connect them to what's available. If childcare is their primary concern, then the community resource coordinators will reach out to folks that are in their community to figure out what the options are. So I don't think there's anything that's off the table. I think the idea, we have certain supports that we've heard are really the barriers right now, and that's why we were trying to make sure that we stood up specific programming for those. But really nothing's off the table. It's trying to figure out how to meet individual needs so people can stay home and stay safe.
Commissioner, would you mind talking a little bit about the overall size of the CRC program, how many community resource coordinators might be available statewide, and sort of what the cost might be?
Yeah, that's a great question. So we based our community resource coordinator programming on the testing strategy. So where we were going to be doing the most testing, where we thought that the highest risk might be, and tried to make sure that there was statewide coverage. So the numbers are actually flexible numbers. We asked all of our resource coordinator host organizations to start at a minimum level, and we did this as a competitive procurement, again looking for community-based organizations that already knew their resources, knew their communities, knew who was there. So we did a competitive procurement, and we said, we're going to have you start at a minimum staffing level, but we want you to be able to ramp up based on the testing numbers and the modeling that we had. So at peak, we could have 50 resource coordinators, and again, they're coordinating. They're not providing every service themselves. They're doing a great job of being able to connect to what communities have already built together. We don't want to reinvent the wheel. We can't afford to reinvent the wheel. So they're really building on what already exists and helping people navigate to those.
Just to add to what the commissioner just said, what I think is so powerful about this is that it is building on existing partnerships. For example, the CRC here in the Hartford area is the Community Renewal Team, which is already working hand in hand with our health department on a daily basis. When we have seniors who may have difficulty getting out of their homes to get food, we work with CRT to make sure that food gets delivered. So those partnerships are there, those partnerships are strong, but this initiative expands those partnerships even further and makes that specific commitment to anybody who tests positive that we will do whatever we can to support you, and as the commissioner said, on an individualized basis. So the question about childcare, we do have childcare resources in the city. If that's one of the things that is an obstacle to safely isolating, we're going to work with the CRC in our area and try to make that happen. And so that to me is one of the things that was so important about the design of this program, is that it wasn't starting from scratch. It was building on those existing partnerships.